Yes, today we're going to talk about a common plague of aging, okay? Brain fog. And this is especially addressed to the 60 plus individual. I just had a conversation with Dr. Anna and Kathy. There's a big difference between 50 plus and 60 plus. Though I think that a lot of the comments that are going to be made today and some of the things that Dr. Anna covers will be applicable to anybody with brain fog. But I'm Bonnie Church. And as you know, my passion is matching people to the resources they need to live a healthier life. And one of my favorite resources is Dr. Anna Garrett. I'm excited to have her here today, and I wanted to give you a little background on her. This lady is a doctor of pharmacy and a board-certified pharmacotherapist. She's a certified intrinsic coach, which means she helps women create and stick to new habits. She's also a certified Nutrametrix health professional, which means she's trained in functional supplementation and has access to nutraceuticals that meet her very high standards of quality and efficacy. And Dr. Anna's passion is this. She loves to help women escape hormone hell. Okay, so some of you understand where we're coming from here. She wants them to feel amazing in their bodies and just rock their mojo through midlife and beyond. And I'm kind of in the beyond right now, so I want to keep rocking my mojo for sure. She's the author of a book, The Savvy Sister's Guide to Hormone Harmony, and it is such an easily accessible, understandable guide to help you kind of navigate the throes of that hormone roller coaster that all of us women go through, and men, by the way. But along with Dr. Anna, I have my friend here, Kathy Troidal Jackson. Kathy is retired from a 40-year tech sales career at IBM and Salesforce, and she's now a full-time certified Nutrametrix consultant and wellness product specialist. Okay, so that's a great transition into another career. And she loves helping health practices build wellness into their patient care. Her goal, which is wonderful, is to improve the effectiveness of this world's healthcare, one practice, one patient at a time. And her passion for wellness is further stoked by the fact that she is a breast cancer survivor. So welcome, Kathy. And I asked Kathy to join me because she was the one who actually introduced me to Dr. Anna Garrett. So it seemed perfectly appropriate to have her as a co-host. So today we're going to talk about aging and brain fog and other things specifically. So Kathy, take it away with your first question.
Sure. Yeah. Thanks for including me on this, Bonnie and Dr. Anna. Great to see you again. So brain fog, lots of different definitions for brain fog. In fact, I've gone through several my own self, but mild memory loss, some refer to it as, you can't remember that name, you can't remember that word in the sentence right away, where you put your keys or your glasses. Difficulty paying attention or focusing, confusion, maybe spaciness. And when I was working, challenges in processing information, right? So it seems to plague some of us at different times in our life and in different ways. Senior moments is kind of a blanket discussion for that. But the first way to resolve something is to understand the cause. So can you share with us what might be at the root of it and why it affects our energy and our mood?
Sure. Well, you're not the only one that experiences going into the pantry and not having the first clue while you're there. It's like, but one of the tips I heard about, I'm going to talk about a tip. One of the tips I heard about that was if you just walk back out of the room and just forget about it, it'll come to you. So, and that generally is the case. But anyway, that's not what your question was. So there are a number of different reasons for brain fog. And I'm going to speak basically to women over 60 because this is when it tends to become more and more of an issue. And of course, everybody's first thought when they have this is that, oh my God, I'm getting Alzheimer's disease, right? And so, everybody freaks out because, we don't want that. But honestly, the biggest causes that I see of brain fog, first of all, lack of sleep. So there is an epidemic of lack of sleep in the country because we all think, oh, I only need 4 hours of sleep. Or you're in some sort of hormonal shift where you just can't sleep, and we'll talk about hormones more later on. But the thing about lack of sleep is that actually studies have been done that show that if you get less than 6 hours of sleep a night, that is the equivalent of driving drunk as far as your mental function goes. And so when I'm working with my clients, even if they can't sleep during their whole container, so I ask them to create a container of sleep. My container is 9:30 to 6 in the morning. And am I asleep that entire time? Fortunately, these days I am for most of it, but a lot of people aren't. But to at least provide the space for that to happen. So don't be up at midnight, folding your laundry, and assuming that you're going to be able to function well the next day. So, it's basic sleep hygiene stuff. That's where I start, because lifestyle in my practice is always the foundation. And then we go to supplements, and then we go to hormones if needed. So sleep hygiene, going to bed at the same time every night, having a dark, cool room, keeping your animals out of the bed if they make you hot, having the right amount of covers, not eating late, right before you go to bed, avoiding alcohol. And that's a huge one actually for women, because you don't process alcohol nearly as well as you age. So those are some of the just basic sleep hygiene things.
What about naps, Anna? Does that help hurt? Count?
Yeah, that really depends on who you are. I mean, if you take naps and you find that you can't sleep at night, then naps are not your friend. Some people are really refreshed by a 15 to 20 minute power nap in the afternoon. I am not one of those people, because if I do it, I will not be sleeping. Same with falling asleep on the couch watching TV. So I actually use an Oura ring to track my sleep. Yeah, there you go. And it's actually valuable information, and you're able to see the impact of your habits on what shows up on the ring. So is it always accurate? I'm not sure, but it gives you trends. So that's one thing. Another reason for brain fog, it can be chronic stress. So your body makes cortisol in response to chronic stress. But as that stress continues on and on, your body doesn't respond as well and produces less cortisol, because it's a feedback mechanism with your brain. And so your brain senses, oh, we've got plenty of cortisol, we're not going to make as much. And so it ramps down the production. And that's when brain fog can start. Some people call this adrenal fatigue, but that's a bit of a misnomer, because it's not like your adrenal glands just get tired and quit working. It's the brain's feedback that is causing that to happen. In its worst case, it becomes Addison's disease, and that's a medical emergency and not something that you're probably going to have. But you can be just sort of non-functional. You just can't get through your day. You're living on caffeine. You're eating salty snacks, because salt helps raise your blood pressure, because your blood pressure falls when your cortisol is low, and then your brain just doesn't work as well. Nutrametrix has a great product called Axe that I personally love. It's got ashwagandha in it, which helps regulate cortisol, whether it's high or low. So that's one that I've actually used for a number of years. So cortisol, stress, all of that. And then dehydration is something that we probably don't really think about all that often as far as being a source of brain fog. And it's also a source of low energy. So my recommendation for my clients, because I can easily remember this, is a 1/2 ounce of water per pound of body weight. So if you weigh 140 pounds, 70 ounces should be your goal. Now, having said that, that is easier said than done for a lot of people. And so what can you do to help with that? Well, I have people use, see, here we go.
Electrolytes?
Yeah, thank you. So electrolytes in your water will actually help the water hydrate you better. That doesn't solve the quantity problem necessarily, but one of the things I did when I worked in a clinic was the clinic I worked in, the patients there were supposed to drink a certain amount of water to go with the medication that they were on. And so what I would have them do is basically put rubber bands around their water bottle and then take them off as they finished each bottle of water. That works okay. There are also apps that you can set to remind yourself to drink. I had one on my phone for a while and it just annoyed me so much that I took it off. So it didn't work for me. But it's just finding a strategy that works for you. And ideally, you want to be sipping all during the day, not guzzling 16 ounces all at once, because that's just gonna run right through you. So your goal is basically to have your urine look almost clear or pale yellow. And that tells you that you're pretty well hydrated. If you wait till you're thirsty, you've waited too long. So getting a good level of hydration is a great energy booster, and it helps with sleep and it helps with brain fog. Let's see. Nutrient deficiencies are another common problem in brain fog. So B vitamins are critical for energy, especially B12. Magnesium, vitamin D also come into play because they're involved in all of our cellular processes. So it's important to be getting enough of that. All of those things can be checked on labs. If you're going to check magnesium, red blood cell magnesium is the way to go, because we want to see what's inside your red blood cells, not what's circulating in your serum. And then lack of iron is also another big one. And so for the purposes of this webinar, that's probably less likely to be a problem, because I would guess that most of all of everybody is past menopause. And so you're not getting that monthly blood loss. But in younger people who are still having periods, especially if they're heavy, iron deficiency is a huge source of brain fog. So, Bonnie, I know you wanted to talk about one of the Nutrametrix supplements that's pretty new to the line, the NAD plus.
Yeah.
Do you want to talk about that a little bit now?
Yeah, NAD, it's short for nicotinamide adenine dinucleotide, and you'll never have to say that again, I promise. But it's kind of a naturally occurring molecule in the body, and its levels decrease as we age. And NAD kind of works like I've heard it described as like the charger for your phone. So you know how useless your phone will be if you don't have a charger. So that's how NAD works in our body. And without NAD, we would die instantly. Optimal levels of NAD have been associated with slowing down the aging process, increasing energy, protecting muscle from degradation, which, you know, as we age, we can lose muscle mass pretty quickly. Improves cognitive function, which is the theme of our presentation today. You actually reduce levels of NAD appear to be linked to neurodegenerative diseases. And I've had a couple of people ask me about how can I prevent my cognitive decline, dementia, Alzheimer's. NAD is probably a good foundational nutrient to consider to support healthy cognitive function. It protects the neurons in the brain. And it decreases nerve-related inflammation associated with cognitive impairment. Also reduces cholesterol, lowers triglyceride, and elevates good cholesterol, may reduce cancer risk, improves sleep-wake cycle, reduces the damaging effects of inflammation. You know, we can't completely prevent the natural decline of the human body's NAD, but we can supplement to help bring up those levels. Recently, the Nutrametrix line has introduced a NAD plus. And what I love about the NAD plus is, of course, like everything in the Nutrametrix line, they offer things at an efficacious level that is science-based, very, very important, based on clinical research. But it also contains something called pterostilbene. And terostilbene has a lot of the same properties as resveratrol. And resveratrol has been touted as, having a lot of similar properties to NAD. So the terostilbene actually is a little better than resveratrol because it does all of the same things, stays in your blood longer, so you have a greater impact with it.
Well, thanks for that. And I think since you just touched on brain health, why don't we talk a little bit about maintaining good brain health and how to do that. And then I've got some other things to talk about, but I want to make sure that we get into this because it is such a hot topic, number one, and the consequences of not maintaining your brain health can be so devastating.
Yeah, Anna, before you get started there, I loved the discussion of the kinds of things to look for in the blood results. And iron levels can go down for all sorts of reasons, but how often should you be checking your blood levels? And as you go through the brain health thing, are there other ones we should be looking for? And how often to see progress?
Well, so I would say, so when you're checking iron levels, it's not, you can get a whole iron panel, but what we really want to see is ferritin. So ferritin is a protein that stores iron, and your iron panel can look absolutely normal, but your ferritin can be rock bottom. And so that's why it's important to include that. And it's not something that most doctors will do without you asking. So that is a consideration when you're asking for different labs if it isn't brought up. So iron is really slow to come up. So I would say you probably don't want to check that any more often than every 4 months. And you do want to keep an eye on that because iron overload is as detrimental in a different way as lack of iron, because it can deposit in tissues and basically you rust, and we don't want that either. So I usually have my clients do it every 4 months while we're actively managing it. And then once you're at a good level, which means you be between 70 and 150 on your ferritin, then you can back off of that. Now, whether or not to stop the iron comes down to, has the source of blood loss gone away? So you've got to make sure that you look down to the root cause and determine whether or not that's been dealt with as well. So I could go on and on all day about this one. Magnesium, RBC magnesium, if it's in the normal range, magnesium's a little tough to get because our soil is very depleted of magnesium. But if it's normal, I wouldn't say you'd probably need to do that more than once a year. Vitamin D, very easy to get. You want that to be between 50 and 70. Again, are you actively trying to increase it or are you maintaining? So the frequency of the lab check depends on that. What was the other one I said? Okay, I don't remember what the other one I said was. Oh, B vitamins. So B12 and B6 are really important to check. B12 can be managed with sublingual drops. That's my favorite way to do it. Some people require injections, but you want to make sure that your level is somewhere between 700 and 1,000, ideally. B12 is really important for energy, and it kind of goes hand in hand with iron as well. So, again, 3 to 4 months if you're actively treating it. You can go longer if you're not.
Great, thank you. That really helps.
Okay. All right. Let me get myself back in the way.
Yeah, you're going to focus on brain now.
Okay. So as far as maintaining brain health goes, there are a number of lifestyle things that you can do. So we already talked about sleep, and that is a very important component of brain health. Diet is super important. So clean, healthy diet. One of the things that can be a marker of what may be going on in your brain is if you have cardiovascular disease, because cardiovascular disease is inflammation in your cardiovascular system, but inflammation is an equal opportunity kind of disease, and there's no reason it's not going on in your brain too. And so you want to make sure that you're keeping inflammation down by eating a healthy diet, low processed foods, lots of fruits and veggies, and then staying active, because exercise has been one of the things that's been shown to really help with maintaining cognitive health. And doing new things. So like I take piano lessons. Am I ever going to be a concert pianist? No, I'm not. But that is my Alzheimer's prevention strategy. I do the Wordle puzzle every day because I want something to keep my brain going. So, I know when people retire, for some people, there's this tendency to just kind of sit down and say, okay, I'm done. Fortunately, I'm not retired yet, but I'm not a person who's going to sit down and not want to learn new things. So I would just say, find something to stimulate your brain, learn new things, and keep it moving. And then I want to talk about hormones. So as estrogen declines, there is a tendency for brain fog to become worse. And it is much worse in some women because of a genetic predisposition they have that makes their brains exquisitely sensitive to falling estrogen. And so that's the ESR gene, and that can be tested for. But those women have really, really severe brain fog problems when their estrogen levels fall. And I would say probably all of us do to some extent. And there is an increasing body of evidence that is coming out now about the importance of maintaining your estrogen levels all through your lifespan, not just up until menopause. I know this has been very, very controversial. There was a study in 2002 that just like took the wheels off the estrogen train. But sub-analyses of that study have shown that estrogen does not cause cancer. And that's just the bottom line. And so I want my brain to stay healthy. I want my bones to stay healthy. I want my cardiovascular system to stay healthy. And I have a terrible family history of breast cancer, but I decided 2.5 years ago, mainly because of my sleep, that I wanted to go on estrogen, and I did. And it's been really life-changing for me from a sleep standpoint. So not here to push hormones on anybody, but there is a book called Menopause Brain that is written by, I think she's a doctor of psychology named Lisa Mosconi, that goes into this. And I haven't read this one yet because it really only came out like 3 weeks ago. And then she also wrote a book called XX Brain, meaning female chromosome brain, that talks about the importance of estrogen throughout the lifespan. And then there's another book by a physician named Avril Blooming. It's called Estrogen Matters, and it goes into the science of brain health, bone health, cardiovascular health, and the breast cancer studies. So I think that's worth having a conversation with your doctor about if that's something that you want to consider. The current guidelines say that you shouldn't start estrogen if you're more than 10 years past menopause. That is not always true, but you do need a more in-depth cardiovascular workup before you go down that road with somebody who knows what they're doing. So I'll just say that.
Right.
So those are the big things as far as cardiovascular cognitive decline that you can do to kind of stave things off. Because what we're trying to do is prevent the plaques and tangles that form in your brain and basically create Alzheimer's. So let's talk about a couple more things that can contribute to brain fog. I got my most important one in there. Food sensitivities actually can be a big source of brain fog. So if you eat something and you notice that like an hour or two after you eat it, you're just like, I don't understand why my brain is so fuzzy. food sensitivities should rise to the list of what's going on. So I'll tell you a story. My partner was eating eggs every day for breakfast. And every day he'd be like, wow, I'm just not thinking straight. And so I said, let's do a food sensitivity test, because why not? Doesn't everybody do that? And it turned out that he was allergic to egg yolks and egg whites, and took that out of his diet, and it's like, boom, no more problems. And so people say, well, what am I going to eat for breakfast if I can't eat eggs? Well, there's a whole universe of foods out there that if you get the label breakfast food out of your head, it suddenly opens up this whole wide world of food that you can eat. So there's a lot of other choices, and he's managed to make that work. But usually, if somebody suspects food sensitivities, I'll recommend that they try an elimination diet first, because it'll save you about $400, number one. And so gluten, dairy, eggs, soy, corn, sugar, peanuts are the 7 that you probably want to take out of your diet. So you do that, and then you start reintroducing them one at a time after a few weeks and see how your body reacts. And so you need to then pay attention to what's going on in your body. And a lot of us, myself included, don't do that because we live in our heads and we just are like, oh, that this body is attached to my head and it has no bearing on anything. But the elimination diet actually does require that you pay pretty careful attention to what you're feeling after you have a meal. If the elimination diet doesn't have anything that surfaces, then you can certainly do food sensitivity tests. I use the KBMO. I think it tests for 176 different foods and additives and spices. I have questions about its reliability, I'll be honest. So I pretty much stick to the elimination diet. And then some medications are famous for causing low energy and brain fog. Number one of those would be blood pressure medicines, especially beta blockers. So beta blockers are anything that ends in LOL. Yeah, that's true. I had to spell a couple of them to make sure that was true. OL for sure. So any blood pressure medicine, if it's dropping your blood pressure too low, is going to make you feel really foggy and probably dizzy on top of it. But some can just cause, fatigue and low energy. So if that's happening, ask your doctor if there's an alternative that can be substituted for that. Anti-anxiety drugs like Ativan, Xanax, all of those can create brain fog. Seizure medications, tricyclic antidepressants, which are a pretty old class of drugs. You don't see them used quite that often anymore. Narcotics, sleeping pills like Ambien and Lunesta. I don't remember all of them now, but and I'll say about them, they are a very tough road to go down because they're extremely hard to get off of. And so if you can do other things to help improve your sleep, including cognitive behavioral therapy, because that can make a huge difference in sleep. And there are people that specialize in sleep disorders, they're therapists. I would use sleeping pills as a last resort, and I speak from experience. So, and then some of the drugs, if you're having issues with incontinence, they can also cause brain fog because they just kind of dry everything out, your brain, your mouth, your eyes, the whole thing. So don't stop any of those without talking to your healthcare provider, but just know that common meds can have an impact on your brain function. So I'm going to stop there.
Great. Well, Dr. Anna, this is just a wealth of information. Thank you so much for all the tips and tricks and thoughts and tests and ideas. We will definitely be sending out an email that includes a lot of the links to the things you talked about, to what Bonnie's talked about, books you've recommended. So is there anything else you want to add before we end?
Yeah, I have one more book about stress, why zebras don't get ulcers.
Ah,
that I'm currently reading.
excellent. We'll put,
It's a better listen than it is a read.
okay.
Well, this has been wonderful. And we thank you so much, Dr. Anna, for
Absolutely.
being with us.
I'm happy to do it.
I'm learning so much from you. And I will be transcribing this and giving you like everything that she's talked about. I'll have it all listed. This is why it's going to take me time before you get your replay, but I'll make sure that you have all the details, all the tips that she's given us, and some of the science behind some of the things that she's saying. So you'll be well equipped with the follow-up email with the recording. So thank you so much. And Kathy, it was so wonderful. This is our first time hosting something together. It's been great.
This is great.
Yeah.
Well, and I'm glad we finally got around to this. It only took us, 6 months?
Yeah, just 6 months. You're worth the wait. Yeah.
Well,
Absolutely.
thank you. And thank you for being patient with my overwhelmed life for a little while. So it's all good now.
All righty. All good. Well, thank you all for joining us, and be looking for the recording. It will be sent your way as soon as I can get things transcribed. So
Okay.
sooner rather than
Thanks
later.
for having me.
All righty.
Bye, everybody.
All right.
Bye, Dr. Anna.
Bye, everybody.